Leah, you talk about measurement, and there may be variation in different measures, different methodologies, different studies. You mentioned a number that I've seen of 1 in 4 patients being harmed or having an adverse event. There was a headline just recently that I shared with you. U.S. hospitals are getting safer for patients study finds, and I'll link to that in the show notes. But the summary seemed to be that certain adverse events were down from about 20% down to 10%. So whether it's 10% or 25%, curious to hear your thoughts on some of the measurement variation, and what are the implications for what we need to continue doing.
Well, the study you mentioned in JAMA was frankly very exciting for us to see, because it takes the time period from when we started the safety grade to about 8 years into it, so 2019, so prior to the pandemic, and really saw significant improvement across a range of adverse events. So not just one adverse event, but many. So, a lot of times in patient safety, the habit is to say, well, we're going to focus on central line infections, or we're going to focus on this or pressure ulcer, one thing. And then we see an achievement, but then we break open the champagne, and then the next day it's back. Mm-hmm. Like we have this way of kind of taking on one at a time. This was about a really cultural shift that we just don't see results like that ever. I don't recall on almost any factor, regardless of whether it's safety or anything else. You just eat public health studies. You don't see results like this across the board, 15, 20% improvements, et cetera. Okay, so there's lots of reasons to be excited that somehow we're on the right track. Mm-hmm. We like to think, yes, having some transparency around patient safety, having hospitals for the first time advertising that they did well, or putting out, press releases that they did well on patient safety. We've seen hundreds of thousands of that over the past 10 years. That's a new factor. The whole idea of being very, very public about patient safety has changed. And we take some credit. So that's all great.
Yeah.
Sadly, we aren't looking at all of the events that happen. We're looking at those that measure, and that's not all of them. And as we just talked about, unfortunately, we did see massive deterioration during the pandemic. So I'd love to be excited, but I think we have a long way to go. But we definitely are doing something right, and we have to build on that.
Yeah.